Delirium is a mental state in which you are confused, disoriented, and not able to think or remember clearly. It usually starts suddenly and is often temporary and treatable. Delirium is the only neurocognitive disorder that can be temporary and is treatable. The DSM-5 diagnostic criteria is as follows. Criteria A, a disturbance in attention and awareness. For example, reduced ability to direct, focus, sustain, and shift attention, or reduced orientation to the environment. Criteria B, the disturbance develops over a short period of time, usually hours to a few days, represents a change from baseline attention and awareness, and tends to fluctuate in severity during the day. Meaning a person can start the day with mild inability to focus and remember, and by the afternoon has a severe inability, and by evening goes back to mild, and so forth. Criteria C, an additional disturbance in cognition, for example, memory deficit, disorientation, language, visuospatial ability, or perception. Patients experiencing criteria C may often ask questions like, "Who is that woman?" regarding their wife, or "Where am I?" and they've been in the same location for a few days. Criteria D, the disturbances in A and C are not better explained by another pre-existing or established or evolving neurocognitive disorder and do not occur in the context of a severely reduced level of arousal, such as a coma. Criteria E, there is evidence from the history, physical examination, or laboratory findings that the disturbance is a direct physiological consequence of another medical condition, substance intoxication or withdrawal, or exposure to a toxin, or is due to multiple etiologies. DSM-5 diagnostic criteria continued. When diagnosing a person with delirium, you want to specify whether it is substance intoxication delirium, substance withdrawal delirium, delirium due to another medical condition, or delirium due to multiple etiologies. In substance intoxication delirium, the diagnosis should be made instead of substance intoxication when the symptoms of criteria A and C predominate in the clinical picture and when they are sufficiently severe to warrant clinical attention. It is also extremely important to make a note of the drug or alcohol that the patient is using to become intoxicated. In substance withdrawal delirium, the diagnosis should be made instead of substance withdrawal when the symptoms in criteria A and C predominate in the clinical picture and when they are sufficiently severe to warrant clinical attention. It is also important to note in this type of delirium the specific drug or alcohol that the patient is withdrawing from. Delirium due to another medical condition should be diagnosed when there is evidence from the history, physical examination, or laboratory findings that the disturbance is attributable to the physiological consequences of another medical condition. For example, if a patient has a pre-existing medical condition, you want to make sure that that pre-existing medical condition is not the reason for the delirium, or if it is. And delirium due to multiple etiologies should be diagnosed when there is evidence from the history, physical examination, or laboratory findings that the delirium has more than one etiology. For example, more than one etiological medical condition, another medical condition, plus substance intoxication or medication side effect. Additionally, you want to specify if the delirium is acute or persistent. In acute delirium, it lasts a few hours or days, while in persistent delirium, it lasts weeks or months. You also want to identify if it is hyperactive, hypoactive, or a mixed level of activity. In hyperactive delirium, the individual has a hyperactive level of psychomotor activity that may be accompanied by mood lability, agitation, and/or refusal to cooperate with medical care. In hypoactive delirium, the individual has a hypoactive level of psychomotor activity that may be accompanied by sluggishness and lethargy that approaches stupor. And in mixed level of activity, the individual has a normal level of psychomotor activity, even though attention and awareness are disturbed. Mixed level of activity also includes individuals whose activity level rapidly fluctuates. In this slide, we have 2 YouTube videos, one of Audrey Curtis's personal story with delirium, and the second video explaining delirium and also comparing it to another neurocognitive disorder such as Alzheimer's and the difference between the two.